Okay, so I have two choices today. Listen first. I have a summary of what developmental pediatricians do, just kind of like an overview of the schooling, what they do on a day-to-day basis, because on Friday we were talking about being, a doctor. We asked if he wanted to do neurology or pediatrics, and he said peds. So that's an option. We can do that, and then I'm going to ask you some questions just to see how you're retaining things. We'll do some comprehension stuff. And then we can do questions, or we can do questions and then do that the last 10 minutes. So which one do you want to do first? The reading or questions?
R E A D I E
Close.
N G. Reading.
Okay. So I'm going to probably read it in 2 sections, and then I'll ask questions because it's 5 paragraphs. But you can look at it too while I'm reading. So it's right here. It says a developmental pediatrician, sometimes referred to as a developmental behavioral pediatrician, is a doctor who primarily focuses on the overall development of a child from birth to adolescence. So that's teenage years. As with any doctor, a developmental pediatrician goes through medical school in addition to training and certification in a variety of behavioral issues. Doctors in this specialty evaluate, diagnose, and often manage the treatment of children with both congenital, which is from birth, or acquired behavioral issues, as well as those with social and motor skill delays. They provide treatment in a variety of settings and often help with the patient's specific issues and also the child's family dynamic. We're going to do the second paragraph too. A doctor who chooses to specialize as a developmental pediatrician typically goes through the requisite 4 years of medical school and a 3-year residency, as most doctors do. Following residency, a doctor often takes additional courses in childhood development and behavior and possibly partakes in an internship or fellowship focusing on pediatric medicine. Many countries provide board certifications for developmental peds, and doctors wishing to focus in this area typically have to pass a special exam in order to obtain certification for this specific specialty. So I'm going to turn this away now. All right. Do you feel like you heard everything I was saying?
Yes.
Okay, I'm going to pick 2 things to ask you. So the first thing I'm going to ask is, how many years of medical school? So you have your undergraduate degree, so that's 4 years. But how many years of medical school will you need? Would you need?
4.
Mm-hmm. And how long is the residency?
3.
Good. All right, you can clear that. Let's see. So a developmental pediatrician can also be called what? What else can you be called? Make sure you clear all of that out. What's the other title?
D E V E L O P
Stay focused like that. You're doing really good.
M E N T
Good.
A.
Nice. You almost got that K, but you're able to fix it. Good job.
V E G
Good correction.
H A V I. O. R.
Keep it up.
A. L. P. E. D.
Good. Yep, that's how you spell
I.
it.
A. T.
Mhm. Keep going, you're almost done. I know, it's long.
R.
Look up at the top. See where you're at in the word.
I. C.
Hmm.
I.
Good.
A. N. Developmental behavioral pediatrician.
Yeah, you got it. I know that was a lot to type, but I
You
really
did
wanted
fine.
you to type all that, so that was awesome.
That is amazing.
Okay, let's keep reading. We'll do two more. It says, a developmental pediatrician focuses on all of the numerous issues that can delay a child's physical development, such as sleep or eating disorders, motor skill delays, or speech delays. Developmental pediatricians also treat issues such as attention deficit disorder, so ADD, attention deficit hyperactivity disorder, so ADHD, oppositional defiant disorder, ODD, learning disorders, and autism spectrum disorders. These doctors also help to address many of the issues that children with Tourette syndrome, Down syndrome, and cerebral palsy face. Hospitals, rehab centers, and even schools often employ a developmental pediatrician. Many major hospitals, especially research and children's hospitals, often dedicate an entire department to developmental pediatrics. A developmental pediatrician may also work at a private practice, for a health department, or for a community outreach program. Outside of evaluating, diagnosing, and treating behavioral issues, a developmental pediatrician usually provides general pediatric care to patients as well. Okay. Did you understand all of that? You got it all?
Yes.
Okay, we'll do 2 or 3 questions from this section too. So, let's see what we talked about here. Different things that they address. So let's start with some of those disorders. Do you remember maybe 2 of them? 2 types of issues that developmental pediatricians help with?
A. U. T.
Good.
I. T.
So close. Can you fix it? Nice and slow. Good job.
S. M.
And we'll say and because we need a second answer.
A. N. D. O. P. P. O. S. I. T.
You're doing great with that spelling.
I. O. N. A. L.
Good job. Keep going.
D. E. F.
Mm-hmm.
I. A. N. T. C.
Good job. Very close. Very close.
D.
Mm-hmm.
I.
Finish strong.
S.
You're doing great today. Miss Corey would be so proud of you.
R. D. E. R. Autism and oppositional defiant disorder.
Yeah, good job. Let me think of another one. Okay, so you're right. So we said that, and then there's ADD and ADHD, Down syndrome, all those. That was a very good answer. Okay, it also talked about different places that you can work. So I'm going to ask a little bit more of a specific question for you. So since you want to be a developmental pediatrician, or that's something on your radar for the future, what kind of setting would you want to be in out of all the ones that we talked about from the paragraph? Where would you want to work? You can try to find it in here. We might be able to. I think, yeah, if you went into places.
I think you're going to get a perfect score on the SAT.
Now, probably not activities. Let's go, where were we? I think you were in the right place. So go to places, and then maybe community would be good. And see if what you're looking for is in there. So look at all your choices.
Hospital.
Hospital. So you would want to be in a big hospital?
Yes.
Okay. Would you want to be in, let's say, a typical hospital like Centera, or would you want to be in a hospital like CHKD where it's all kids no matter what and tends to be more serious cases? Where would you want to be? And you can just use Centera or CHKD as examples.
C. H. K. D. CHKD.
Okay. So in this side of the country, we have CHKD, we have Johns Hopkins, Boston has a really great children's one, so any of those. Very cool.
Very impressive, Nicholas.
All right, we have one more. It's kind of a small section, so we'll probably only do one question from it, and then we'll be done. It says, unlike most general pediatricians, a developmental pediatrician often provides treatment for not only the young patient, but also the child's family, as most developmental delays and behavioral issues are best treated and managed as a joint effort among doctors, teachers, and families. These specialists typically work with parents and caregivers to help with any family issues that stem from the patient's diagnosis. This can include parenting advice, family therapy referrals, and instructing caregivers on how to provide developmentally delayed children with the care they need to reach their full potential. So that was a big kind of counseling paragraph. So I'm trying to think of a question I want to ask with this one. So for counseling, is that something that you are interested in too?
Yes.
Okay. So out of all of the different things that we talked about, the developmental pediatricians do, what do you like the best? So do you like the counseling? Do you like the disorders? Do you like the hustle and bustle of the hospital? What's your favorite thing that you've heard from what we read?
T. Y. H. E. C. O. U. N. S. E. L. I. N. G. The counseling.
Okay, the counseling. So what makes that your favorite? Why do you think it's so important? It sounds fun. Okay. So counseling, it sounds like a fun part. If you had something, let's say that I'm your patient and we'll kind of role reverse, and you wanted to give me some advice. Maybe I was struggling with either my speech or maybe social skills, and I'm a teenager with, let's say, autism and ADHD, and I'm having a really hard time. What kind of advice would you want that maybe you wish that you could have gotten or that you would want now?
T. O. S. T. A. Y.
Take your time.
P. O. S.
I'm right here. I'm just trying not to touch you. I'm trying to give you some independence.
I. T. I. U.
Very close.
Just stay position. U.
We missed that spelling a little bit. Let's keep going. So we got to go back to that I because we accidentally did too much.
U.
So close. What letter do you want there? Look at the top. What are you trying to say?
V. E.
Mm-hmm.
Just stay positive.
Stay
Nikki, I
positive.
have never
Okay.
been more proud of anybody in my whole life.
Yeah. Those are some tough questions. And you know what? Those are all questions that you as a teenager becoming an adult, that's the higher level stuff that, you know, we want to see from you, and that's going to help you to accomplish being a doctor. And the fact that you are so easily able to do it on your own, because we really haven't worked on questions this difficult. That kind of higher thinking, what advice would you give, stuff like that. We've been keeping it pretty related to yourself. So that's fantastic. Also, from a language perspective, this was a lot of stuff that we read through, and your comprehension was fantastic. So
It's SAT perfect level.
Yeah.
Seriously.
It's
I'm a
really
tutor.
good. Really awesome.
Wow.
How are you feeling right now? Was it fun?
Wow. Just amazing.
Yes.
I think you wanted feelings. Let's go back. They're right next to each other. Yeah. Remember, it's not, I don't want I feel.
Feel.
Good.
Tired.
Tired? Anything else?
Proud.
Tired but proud. Okay.
Can I mention something?
Yeah, absolutely.
Just because we're running out of
Yeah, this took a little longer than I thought, but I think it was good.
so worth
Yeah.
it. It's like the happiest day of my life. Nikki, this is the happiest day of my life, buddy. Nikki, last session, I think you caught Miss Brittany and Mommy off guard with stating that you were not happy with your physical appearance.
Oh, yes.
And I watched the video, and I just wanted to tell you, Michelangelo could not have painted anyone better than you, baby. You're unbelievable. You know that? You know, when God made you, He took you off the production line and made you custom.
That's awesome.
I also want to tell you that when you and I go swimming, which is about twice a week, and we go hiking about twice a week, that is exercise.
Yeah.
And it's valuable exercise. Mommy's going to start lifting weights with you. So in addition to the swimming and the hiking, with the weights, you're going to get really fit. But you look great right now. I just want you to know that.
Yeah, you do.
All the
do.
girls that I tutor that see your picture and the moms, they're like, wow, he is just absolutely gorgeous. I just want you to know that, okay?
Yeah. You're a handsome kid.
Yeah.
And you look 100% normal. Not that it matters. Who wants to be normal anyway?
Daddy's not normal.
But you do.
Anybody will tell you that.
You do. And honestly, I'd say you're probably way above normal in the best possible way, but
What a sweet thing to say.
and there's absolutely nothing wrong with that. That's what's going to get you far in life, is not being the norm.
May I ask one more question?
So, yeah.
What would you like to do after we leave here?
Oh, good question. I don't know if you'll find it in there. You might have to type it. Or if you just don't know.
Maybe. C. A. R. R. I. E.
Very close. If that's what you're wanting to say that is, I don't know for sure.
C.
Okay, I think it is. Get that D. There you go.
D. E. Yes, maybe car ride.
Thank God,
Alright.
because I'm
Okay.
worked up.
Car ride works. Car
All right,
ride
my
works.
man, you got that. We'll go up and down Short Drive and down by
Yeah.
the front. How's that sound?
Pretty soon you'll be able to look at all the leaves and stuff. I think our weather is still a little confused, but eventually there'll be some pretty leaves to look at. Or it's just going to all turn brown and die all at once. I don't know.
Nikki, I just want to tell you, this is the proudest day of my life. I'm going to tell you something, and it's because of you. I am so impressed by you.
Yes. Okay.
Let me add real quick.
You modest guy, you know.
Oh, it's in there. So remember, you've got thank you in the corner there.
Thank you.
So if you don't want to use it, you don't have to. But I feel like we've neglected it because it's on the far side. So just so you know, it's right over here, okay? You don't have to click it again, but you can.
Thank you.
Okay. All right. That's yours.
Thank you, bro.
You're welcome.